क्या वार्निंग साइंस होंगे जिससे पता चलेगा कि ये स्कैम है या फ्रॉड है?
All cancer scams have a particular pattern. कोई बोलता है कि 100% curable है और कोई बोलता है everybody gets cured.
तो पेशेंट्स क्या ऐसा कर सकते हैं जिससे वो अपना होप और एविडेंस को बैलेंस रख सकें?
Have a hope of cure, but stick to the science and follow the proven treatment. I think this is the best combination.
What myths are the most dangerous?
Cancer means death.
Hello, namaste. My name is Garima Kaushal and today we're here to talk about cancer awareness. Today we have with us Dr. M.V. Chandrakanth, cancer specialist, medical oncology, Narayana Health, Kolkata. Welcome, Dr. M.V. Thank you so much for being here today with us. My first question to you is, why are people today so attracted to alternative therapies?
Right. So, cancer has been a challenging disease for all of us. Once someone hears the word cancer, there is a stigma attached to it. They start feeling, I'm going to die. So, that is the stigma. Versus someone hears, I've got diabetes. Fine, I've got a heart problem. Acceptable. But the moment I hear the word cancer, I feel I'm going towards death. So, because of this fear, a lot of subconscious things happen in the mind, and the cancer, to diagnose, you need multiple tests, something like biopsy, a needle going into you, expensive, a very long diagnosis list. Treatment has multiple modalities, long-term, expensive, and nothing is 100% guaranteed. So there is an uncertainty in cancer treatment in spite of all this research. So when a patient or a relative hears all this uncertainty, they start looking into easy shortcuts. It's not deliberate, it's helplessness. They will try and find out easy ways. For example, a herbal way, or someone says some nature cure. So they all look attractive. But my suggestion is that's fair. Doing all that is fair, but we should not delay the proven standard treatment or proven standard test. Please go ahead with all this, but do not delay the actual pathway that you have to go towards.
The actual treatment, right, of course. Do you think alternative treatments can ever replace standard care?
I think this is one of the most important questions. Cancer treatment is multimodality. Like it involves complicated surgeries, radiotherapy, chemo, targeted therapy, and these treatments run for months to years. It's a long treatment with significant side effects. These treatments did not come in one day. They happened by multiple randomized trials. Like they've been tested in thousands of patients. After testing in thousands of patients, we understood that this is the modality that is successful. For example, I can tell you for voice box or throat cancer. What did we do before? We just operated throat, the voice box, and without speech, he had to live his whole life. And he would have a tracheostomy here. He had to breathe through the throat.
Okay.
So then we did trials, like someone, instead of operating, we tried to burn with radiation, and we preserved the organ in some and operated in some. And they showed the outcomes are similar, but the person can live with the voice box without a hole. This is proven among thousands of patients. By doing this, we saw that the cancer doesn't come back, but still you can live with an intact voice. So this did not happen overnight. This required randomized trials. And let's say someone says, let's say a herbal thing, it's benefiting you. You eat this, cancer will reduce. But just by hearsay, you cannot have a cancer treatment. It has to go through multiple phases of clinical trials. First, it should be tested in animals, and then in humans, and then it has to be shown in a randomized manner that it is applicable in large population. So whatever treatment we do, has to be born and has to mature and be tested in a larger population. Only then cancer treatments are proven effective. So if someone says that a herbal medication or a herbal product or a protein product will cause cancer cure, always see what is the evidence behind this. Was it tested in thousands of people? Has it been proven? What are its side effects? What is the approval? For example, in India, it is DCGI that approves this particular medication. Similarly, in US, it is FDA. Similarly, in Europe, it's EMA. So always see whether it is approved or not. If a medication is there and it is approved, it would be written on a prescription straight away by a qualified practitioner. A herbal product may be claimed by a couple of people, testimonials by some patients. We really don't know who these patients are. We see one patient, but what is the denominator? How many people took and what is the benefit? This we don't know. So before we accept any new treatment in cancer, we should always check in how many patients it has been used, who is approving it, how much is the maturity of the data. So before that, we shouldn't blindly accept all these new medicines as an alternative to standard treatment. You can use it as a supplement, provided it is not harmful, but you cannot completely replace these experimental or unapproved medications as a cure, as an alternative to standard treatment.
That makes perfect sense.
Thank you.
So, according to you, what are the risks of delaying the treatment?
The bottom line is cancer is curable if you detect it early. That is the bottom line. Let me give you an example. I had a gentleman who was a security guard in our own hospital. He had a mouth ulcer. So it was there for around 2 months. It wasn't going away. So we said it needs to be biopsied and seen what is this. He said, why don't I take some multivitamins and see how it goes. So he didn't turn up to us. He came after a couple of months saying that the ulcer is not still healing. He self-medicated with vitamins and he came after 2 months. When he came again, we said you have to do a biopsy and see why it's not healing. And then we did a biopsy and the biopsy showed it's cancer. Now, what is the treatment for oral cavity cancer? Treatment is surgery. You need to operate and you have to put a flap here. So you need to do a plastic surgery and construct a flap. So that's a complicated treatment. His face will become disfigured. He may not be able to speech swallow for some time. It's a complicated treatment. Unfortunately, we don't have a treatment. Then it was complicated for him. He had a discussion with his family and they opted for an alternative treatment. He came after 4 months and he reported that there was a transient reduction, but now it had become a big mass that's just protruding out and he's not able to open the mouth right now. So now we did a CT and saw, and now the cancer had gone into, we say, the base of the skull, that it cannot be operated anymore. So now there is no cure. This is an advanced stage, 4th stage, and we don't have a cure, unfortunately, to this person. The same person 6 months back, without a false assurance from an alternative treatment or without self-medication, would have got a simple cure by a simple resection. But the same man, because of these misguided thoughts and misguided by someone that there is a shortcut with a herbal treatment or an alternative treatment, number one, it did not work. Number two, it delayed intervention. It delayed the standard treatment to be started. So now it's not curable. No matter what medication you do, he has to live with it, and his lifespan is not going to be long as per the data. So therefore, cancer is curable provided you detect it early. Don't fall prey to shortcut medicines which delay your treatment or which replace your standard treatment.
I think one of the most important things that every doctor would like to tell you is that, guys, it's your life. Don't play with it. There's a reason there's so many, people are doing research, they're trying to find cure, they're doing so much of hard work to bring about, better results. Trust them, please, but don't play with your lives.
If it were to be so easy, giving a medication and curing it, there would have been more bigger hospitals, bigger institutions promoting it. So you don't see them in a big way. So you see corporate hospitals with approved treatments in a big way, But you don't see these alternative medications so loud and so transparent. They are just testimonials of one or two patients that should not change your thought process in not getting access to standard treatments.
So, sir, how should patients evaluate claims?
Right. So you may hear a lot of claims like if someone had a green tea or a herbal product, well, I am free of cancer right now. So whenever you see a new treatment, how will you understand is this a right treatment or not? For example, if you have to buy a mobile phone, you will always see the review.
Right.
What are the reviews? How many people have reviewed? Okay, which company is this? Does this company have a proper service? Okay, where is it manufactured? How many GB? What is the MB? What is the storage? What is the RAM? So a lot of questions. Is it an iPhone? Is it from US? So where is it? The same thought process you need to also have when you are evaluating any new treatment. So let's say someone says this particular tablet or a herbal powder heals you. You should have a similar mentality. You are able to give at least a lot of effort in buying a new phone. A similar one, you should have a you should put an effort in evaluating a medicine. You shouldn't. Your superstition should go. Your scientific mindset should come in. Okay, so this is the medication what is prescribed, right? So first one, you will say, is it approved by a health authority? Okay, DCGI. Okay, and number 3, this drug. So you will see the reviews. How many people took the review? 4,000 reviews. 4 plus. Wow, that's the way. So similarly, you ask the question: how many people took this?
Correct.
What was the benefit in those patients? What side effects did they go through? Everything is available online in the present day. So you ask this question. If you cannot get access, you ask your doctor. If your doctor is able to say, this is the trial they use, this is the number of this is the one who benefited, and this side effects. Everything is transparent, so clear, and it is approved by DCGI. It is approved by FDA. That's the medicine that's approved. It has been not an experimental drug only. It is an approved drug that you can seamlessly use. Of course, you should know the efficacy and side effect. So the way you do not buy a phone, just go to a shop and you don't pick a phone. Similarly, just don't go to a shortcut and just pick up a pill and think your cancer will get cured. Have the same scientific thought, aware and evaluate, is this a right medicine that's been there.
That's perfect. So, are there any complementary therapies that are beneficial?
So the very word says complementary.
Correct.
Means it adds on to. It's not a substitute to.
Right.
Okay. It supplements, it complements. Okay. Yes, you cannot deny that complementary therapies have no role in management. They do have a role. They have a complementary role. Let me quote some examples. Exercise, structured physical activity. I will give you an example of colon cancer.
Okay.
For those people in whom they underwent colon cancer surgery, after that was asked to do a structured exercise for 2 to 3 years. By doing that, the cure rates doubled. The cancer didn't come back in them. So definitely exercise has an anti-cancer property. And this is proven in a randomized trial called challenge study. I will give you another example, an Indian study from Tata, yoga and physical activity in breast cancer. After women got operated for breast, they had this feeling of feeling low, pain, discomfort. When they got into yoga and physical activity, they felt positive, the pain went away, their quality of life improved, they felt more confident. So yoga did add to their quality of living, because a woman operated with breast will have a low self-esteem. By doing this, she felt better. I'll add you one more. People who have caregivers, let's say married individuals, have a better cancer outcome than those who are not married. Means caregiver emotional support is very important. This is also an alternative therapy.
Correct.
And people have looked for something called music therapy.
Right.
Those people who are taking chemotherapy or any cancer procedures, a particular type of music, if they can hear, they feel better, their outcomes are slightly better. That's one. Something called neuropathy happens in cancer treatment. Neuropathy is when you take cancer treatment, your hands and feet become numb.
Okay.
So to improve that, acupuncture has shown some benefit.
Okay.
So all these treatments are good, but they are complementary to the standard proven treatment. They will improve your quality of life and also the probability of cure by preventing them from coming back. But this is a complement to the standard treatment.
Correct. No, that's actually very true that, like you were talking about breast cancer also. Not just breast cancer, any kind of cancer, it does cause a lot of distress, sadness, can often lead to depression also. So having
Right.
emotional support, having physical activity, it does kind of help you boost your.
Right. So there's one more study where the women who underwent breast cancer treatment, they all are cured.
Okay.
They're among us, you don't even know who they are.
Yeah.
They have two fears. One is the fear of cancer coming back, and the other fear is the family may not accept her the way she was before.
Correct.
So now she is cured, she's onto the society.
Mm.
The relatives know that, oh, she had a cancer, so be careful. So the acceptance by society. So these two factors, these cancer patients are cured. Nobody can recognize they had cancer,
Yeah.
but then they fight with these two thoughts. So how to address this? You don't need a psychiatrist for this. What we did was something called group discussion. We got all these patients in a room and just make them talk among themselves.
Yeah.
Okay, in my home, this happens. Oh, in my home also the same. How did you overcome? So
A support group.
They keep discussing among themselves how they handled each. By doing this, they became more confident.
Correct.
And they started accepting the things better, and the fear of cancer coming back reduced. So just by a structured support group directed group discussion,
Correct.
is the situation.
Yeah.
So like two people are in the same difficult phase of life, talk and you're fine. So this is also a complementary therapy.
Correct.
So this improves the way they live their life. Yeah.
No, that's definitely true, for sure.
Thank you.
सर अभी आपने बहुत अच्छे से समझाया कॉम्प्लीमेंट्री थेरेपीज के बारे में, तो यही चीज़ को अगर मैं पूछूं कि आप पेशेंट्स को कैसे रिस्पेक्टफुली इनके बारे में बता सकते हैं ताकि वो ऑफेंडेड भी फील ना करें और लिसनिंग के लिए भी ओपन ज़्यादा हो, क्योंकि ऑनेस्टली मेरे साथ भी ऐसा ये होता है कि किसी चीज़ को मान्यता लेकर किसी से पूछो और एकदम से ऐसे बोल दे नहीं ये सब बकवास है, तो फिर लगता है उनकी भी सुनने का मन नहीं करता, उधर भी शक आ जाता है. तो हाउ वुड यू से इज द बेस्ट वे टू गो फॉरवर्ड?
This is the actual reality. This is very true. I think survey किया था कोई, I think 80% people do take supplementary medicines along with cancer treatment. कोई डॉक्टर को पूछने के लिए डरता है या they feel हमने एलोपैथी ले रहे हैं, ये सब लेने से डॉक्टर क्या बोलेंगे. So and very importantly डॉक्टर्स भी, हम लोग भी बोलते हैं अरे ये सब कोई काम नहीं करता, आप क्यों लेते हो. So that's a very true thing. So from what I do in my practice and what probably we all should do, हमने तो बीमारी के बारे में तो बात करते ही है. In 5 minutes, the first 2 minutes goes in कैसे है, कैसे ब्लड टेस्ट क्या है. The remaining 3 to 10 minutes, पेशेंट पूछते हैं कि क्या खाना है. सर हम क्या ये प्रोटीन पाउडर ले सकते हैं क्या? सर हमने ये हर्बल एक क्या है, ये क्या ले सकते हैं क्या? So काफ़ी सारा उनके मन में जो क्वेश्चन रहता है, जो एक्चुअल ट्रीटमेंट छोड़ के, एक्चुअल ट्रीटमेंट तो हम कर ही रहे हैं, वो तो जानते ही हैं, बट उनका तरफ से भी वो एफर्ट डालना चाहते हैं. जैसे रिलेटिव्स वो क्या करेंगे, अरे मैंने सुना था कि आप हल्दी या टर्मरिक लेने से शायद ठीक होगा, ये लेना चाहिए. सर हम दूध के अंदर हल्दी करके पीना है. कोई बोलता है कि नीम पत्ता का जूस पीना अच्छा है. ऐसा काफ़ी सारा चीज़ें हैं जो पेशेंट लोग पूछना चाहते हैं. उसके लिए नंबर 1 हम लोग रिसेप्टिव होना चाहिए, बिकॉज एट द एंड ऑफ द डे इट इज़ यू एंड योर पेशेंट, एंड व्हाट मैटर्स इज द पेशेंट्स कंफर्ट, बोथ फिजिकल कंफर्ट एंड ऑल्सो द ईज विद विच दे फील विथ यू. एंड मेक श्योर आपने जो भी सप्लीमेंट्स ले रहे वो हर्बल हो एंड इनर्ट हो. दे शुड नॉट इंटरफियर विद द मेटाबॉलिज्म ऑफ आवर एक्टिव ट्रीटमेंट. एंड कभी कभी ये ऐसा इंटरेक्शन से जो एक्टिव ड्रग है उसका लेवल्स कम हो सकता है, बिकॉज दे अफेक्ट द लिवर. सो मेरा सजेशन हर पेशेंट को है कि बी ट्रांसपेरेंट. हर कोई चाहता है कि हम अच्छे हो, और हर कोई डॉक्टर भी चाहता है कि हमको सारा दवाई के बारे में पता रहे। हम बोलते हैं पॉलीफार्मेसी। पॉलीफार्मेसी मतलब 4 से ज़्यादा दवाई कोई लेता है तो उसको बोलते हैं पॉलीफार्मेसी। जब ऐसा मल्टीपल दवाई लेते हैं तो एक दवाई के साथ इंटरैक्ट कर सकता है। इंटरैक्ट करने से लिवर के लिए नुकसान पहुंच सकता है, किडनी का नुकसान हो सकता है और खुद का लेवल्स ऊपर नीचे हो सकता है। इसीलिए आपको बताना ज़रूरी है, कोई भी हर्बल हो या व्हाटएवर ट्रीटमेंट यू आर टेकिंग, बी ट्रांसपेरेंट एंड वी डॉक्टर्स आल्सो हैव टू बी रिसेप्टिव, बिकॉज एट द एंड ऑफ द डे आप मना करके गुस्सा करने से वो थोड़ी ना बंद करेंगे, वो तो अपना एफर्ट तो डालेंगे।
वही, क्योंकि वो भी होता है ना, स्पेशली जब आप इतने बीमार होते हो तो
राइट
अब मेडिकल ट्रीटमेंट तो चल रहा है पर आप पूरा टाइम घर पे जब खाली बैठे हो आपका
Right.
दिमाग चलता रहेगा कि ओ मैं कुछ कर नहीं रही, मैं मुझे ये करना चाहिए या वो करना चाहिए, लोग भी बोलेंगे। तो
राइट
उस मोमेंट में
राइट सुबह उठ के पानी के अंदर नींबू डाल के पीने से कोई प्रॉब्लम नहीं है,
या
पी सकते हैं, हम तो कभी मना नहीं करते, दैट्स फेयर, यू डू ऑल योर एफर्ट्स बट यू शुडंट इंटरफियर विद योर ट्रीटमेंट and it should have inert substances which should not interfere with the metabolism of active medications. It's fair. इसके लिए डरने का जरूरत नहीं है, खुल के बात करना जरूरी है।
वही आई थिंक इफ डॉक्टर्स आल्सो आर मोर रिसेप्टिव कि एकदम शट डाउन नहीं करेंगे तो पेशेंट्स आल्सो विल
Agree.
फील मोर फ्री टू
I
बी एबल टू
totally
शेयर कि अच्छा ये क्या मैं ले सकता हूँ। मेरे साथ भी मैंने जनरली ये नोटिस किया है कि मोस्ट ऑफ द टाइम्स मैं नहीं बताती कि मैं ओके ये सप्लीमेंट ले रही हूँ या मैं कोलेजन ले रही हूँ या कुछ ले रही हूँ, बिकॉज आई एम लाइक मना ही कर देंगे या तो वो हम लोगों में बहुत डर है, पता नहीं क्यों डॉक्टर्स का कहीं से तो आता है ये डर।
So हमारा एजुकेशन, so we are data heavy people, like हमने
करेक्ट,
इतना पढ़ाई किया है कि हमारा ये नॉलेज को पेशेंट में कैसे अप्लाई करे, यही चीज के ऊपर हमारा ध्यान रहता है। और उसमें आप कोई अलग चीज पूछेंगे तो हमको लगता है कि क्या पूछ रहे हैं। सो ऐसा एक फीलिंग हम में आता है, बट पेशेंट के लिए तो ये बड़ा चीज है।
या करेक्ट,
तो हमारे लिए तो लगता है कि ये डजंट मैटर, बट पेशेंट के लिए मैटर करता है। आई थिंक it should be a balance. What patient says, if something is harming, बोलना चाहिए कि better avoid this. So it should be a transparent discussion, and the patient should be open and transparent, and doctor also has to be receptive.
रिसीविंग करेक्ट। मेरे साथ अब जनरली क्या होता है कि एक चीज जो मैंने नोटिस किया है कि अगर मैं कोई ट्रीटमेंट ले रही हूँ और मुझे पता है कि उससे हो क्या रहा है बॉडी में, तो जैसे बच्चे नहीं होते, क्यूरियस होते हैं, उनको जाननी होती है चीजें। तो अगर सपोज किसी चीज के लिए मना करना है तो उनको बता दिया कि अच्छा अगर आप ये करोगे ना तो उससे आपकी दवाई ऐसे इंटरफेयर होगी, तो आप इसको अवॉइड करो, मत करो, आप उसकी जगह में भी ये कर लो, ताकि उनको भी लगे कि अच्छा मैं कुछ कर रहा हूँ या कर रही
Right.
हूँ। बट दैट ऑल्सो आई अंडरस्टैंड कि डॉक्टर्स भी इतने बिजी होते हैं, इतने सारे पेशेंट्स वगैरह रहते हैं, तो वो इतना हर इंसान को टाइम नहीं दे
Right.
पाते होंगे।
All questions from patient are relevant,
यस,
because वो डॉक्टर के पास पूछ रहे हैं, मतलब वो सोच समझ के उनका मन का बात ही पूछ रहे हैं। They have to be addressed.
ट्रू।
Yes.
एंड व्हाट मिथ्स आर द मोस्ट डेंजरस?
Myths are dangerous, जैसा आपने बोला, because they interfere with your treatment and outcomes. Therefore, they are dangerous. किसी को भी कैंसर होते ही पहला चीज मन में आएगा कि कैंसर इज नॉट क्यूरेबल. Cancer means death. So this is a myth. Out of 3, 2 cancers are curable. And the bottom line again, if you detect it early, the cure rates are much higher. So cancer incurable nahi raha. 70% of them are curable. And if they're not curable, they can be controlled for a long period of time. This is the first myth. Second myth, कैंसर का इलाज बीमारी से और तकलीफ देता है।
या
कैंसर ट्रीटमेंट इज मोर पेनफुल देन द कैंसर इटसेल्फ. इट्स अ मिथ. एक टाइम था जिसमें हमारे पास अनेस्थीसिया था ही नहीं, हम सिर पे चोट मारते थे, वो बेहोश होता, ऑपरेशन होता था. दैट वाज अ टाइम. कीमो भी वैसा ही था, हाई डोज कीमो देते थे जैसे पूरा सब जल जाए. नाउ वी हैव मूव्ड far ahead of toxic treatments. अभी आजकल आए हैं मैजिक बुलेट्स, बोलते हैं एंटीबॉडी ड्रग कॉन्जुगेट्स. मतलब पहले क्या होता था, कीमोथेरेपी वेन में देते थे कि वो हर शरीर का हर पार्ट को अफेक्ट करता था. आजकल ऐसा एडीसीज बोलते हैं, एंटीबॉडी ड्रग कॉन्जुगेट्स. दे गो टू द कैंसर एंड डायरेक्टली टारगेट देम. दे आर कॉल्ड टारगेट थेरेपीज. सो आप जैसे एंटीबायोटिक लेने से कोई तकलीफ तो नहीं होता, वैसे ही कैंसर का ट्रीटमेंट में भी ये एडीसीज आने के बाद सिग्निफिकेंटली साइड इफेक्ट कम हुआ है. ऑफ कोर्स साइड इफेक्ट्स तो है, बट नॉट worse than cancer. Cancer is, if you don't treat cancer, it's going to be painful. So cancer treatment is worth it, and the treatment side effects are temporary. They're going to be over in a matter of 2 to 3 weeks. And the third myth is sugar feeds cancer. डॉक्टर साहब हमने ना बहुत मीठा खा रहा था इसीलिए कैंसर हुआ, तो इसको ना कैंसर होने के बाद बहुत मीठा खा रहा है इसीलिए दवाई काम नहीं कर रहा है. शुगर डज नॉट फीड कैंसर, बट कैंसर लव्स शुगर. दिस इज देयर. तो उसका आप कम मीठा खाना सॉल्यूशन नहीं है उसके लिए. इनफैक्ट हम जो कैंसर का दवाई देते हैं वो ग्लूकोज में देते हैं. शुगर रिस्ट्रिक्शन विल नॉट रिड्यूस कैंसर. बट आप कैलोरी रिस्ट्रिक्ट करो, फिटनेस अच्छा होगा, ओबेसिटी कम होगा, मेटाबॉलिज्म अच्छा होगा, बट डायरेक्ट इफेक्ट कैंसर से नहीं है. नंबर 4 इज कैंसर इज कंटेजियस. किसी को कैंसर हुआ, मैं उनको छूने से मुझे कैंसर हो जाएगा, नहीं होता है. कैंसर अंदर से जन्मता है, वो ट्रांसमिटेबल है नहीं. कैंसर इज नॉट कंटेजियस. कोई ब्लड कैंसर का पेशेंट का खून भी हम लेंगे ना, तब भी ब्लड कैंसर ट्रांसमिट नहीं होता है. कैंसर इज नॉट कंटेजियस. एंड नंबर 5, कैंसर इज हेरिडिटरी. तो जस्ट एक कपल था, सो शी जस्ट गॉट मैरिड an year ago and she got breast cancer. The husband is blaming her, oh आपका पूरा परिवार में कैंसर है, आपको क्यों शादी किया. Not all cancers are hereditary. Only 10% of cancer are hereditary.
Doctor, why is it that misinformation spreads so easily?
Cancer is a disease with lot of emotion. Cancer होते ही मन में एक डर और इमोशन एंड स्टिग्मा जुड़ जाता है.
Correct.
तो इसके साथ कुछ भी इंफॉर्मेशन हो, लेट्स से आई विल गिव यू एन एग्जांपल. अरे आपको पता है क्या, कुछ एक जड़ी बूटी है, उसको 30 लोग ने लिया, 30 लोगों को कैंसर खत्म हो गया 6 महीने लिया. तो और एक स्टोरी बोलता हूँ यार, 5000 पेशेंट में गोली दिया, वो गोली देने से क्योर रेट 5% बढ़ा. आपको कौन सा अच्छा लगा? जड़ी बूटी 5 लोग में 5 people took herbal medicines and everybody got cured.
Yeah.
And 5,000 people took a tablet and there was a 5% increment in survival. The first one looked more dramatic,
Correct.
more appealing, more emotional, because it is easy, and it is definitive.
Success rate 100% दिखा रहा है.
Success rate.
Right.
क्योर हो गया सब लोग. 5 को 5 बीमारी खत्म. और साइंस बोल रहा है थोड़ा 5% बेटर है. अनसर्टेनिटी है. कुछ हमको पता है, कुछ हमको नहीं पता है.
इतना क्योर होगा, इतना ये होगा.
So we are not able to cure everyone.
Correct.
Science is always not 100% certain because we don't know cancer up to now. We are understanding the disease. ऐसे देखेंगे तो कोई बीमारी के बारे में हमको पता नहीं है. डायबिटीज किसको क्यों होता है, किसको हार्ट अटैक क्यों होता है, we don't know. बट हमको पता है ये रिस्क फैक्टर्स है, जैसे ओबेसिटी, फैमिली हिस्ट्री, पुअर लाइफस्टाइल आर रिस्क फैक्टर्स. सो जैसे आप टेस्टिमोनियल्स हो, कोई हर्बल प्रोडक्ट हो, उसमें जैसे बोलते हैं कि 6 महीना लीजिए कंप्लीटली क्योर, आप डायबिटीज से मुक्त होंगे, आप कैंसर से मुक्त होंगे. ये स्टोरीज अच्छा है क्योंकि काफी इमोशन जुड़ा है इसके साथ, एंड इजी है फॉलो करना. घर में रहो, जड़ी बूटी खाओ और क्योर हो जाओ. वर्सेस कैंसर में बार बार हॉस्पिटल जाना है, टेस्ट करना है, दवाई लेना है, खर्चा है, सबसे इम्पोर्टेंट साइड इफेक्ट्स है, अनसर्टेनिटी है उसके बावजूद. सो इसके कारण से मिस इन्फॉर्मेशन जल्दी स्प्रेड होता है बिकॉज ऑफ इमोशनल इन्वॉल्वमेंट. देयर इज अ नैरेटिव एंड देयर इज अ स्टोरी बिहाइंड इट दैट इज इमोशनली एक्सेप्टेबल.
तो सर जैसे अभी आपने बताया सैंपल साइज छोटा है, अगर 5 लोगों में 5 के 5 क्योर हो रहे हैं. सो डॉक्टर, हमें कैसे पता चल सकता है, ऐसे क्या वार्निंग साइंस होंगे जिससे पता चलेगा कि ये स्कैम है या फ्रॉड है?
राइट. तो हमने न्यूज़पेपर में देखा या कोई रिलेटिव ने बोला कि पता है ना, उधर आप इलाज लेने से ना सब लोग क्योर हो जाते हैं. तो ये सच है या स्कैम है, ये कैसे पहचाने? ऑल कैंसर स्कैम्स हैव अ पर्टिकुलर पैटर्न यू शुड बी अवेयर अबाउट. कोई बोलता है कि 100% क्योरेबल है और कोई बोलता है एवरीबडी गेट्स क्योर्ड. सो इतना सर्टेनिटी कैंसर क्योर में आज तक हो नहीं सकता है. सो 100% सर्टेनिटी everybody gets cured, it's not possible. You should, I wish it comes, but that's the first red flag that you need to think. Number 2, ये इलाज ना वो एक जगह में ना, उधर पहाड़ है उधर ही होता है. इनके पास ही है इलाज, और कहीं और ये इलाज है नहीं, ऐसा हो ही नहीं सकता। कहीं भी कैंसर क्योर है, वो ये मिस इन्फॉर्मेशन जैसा फैलता है, ऐसा क्योर भी फैल जाएगा। If there is a cure, it cannot be confined to a particular place. It will go viral, and it's true. So ऐसा कभी secretly एक ही आदमी क्योर कर सकता है, ये कभी हो ही नहीं सकता। ऐसे देखेंगे तो वो बड़ा बड़ा हॉस्पिटल बना लेंगे खुद, है ना। नंबर 3, वो जो दवाई देते हैं वो सीक्रेट होता है, कोई डब्बे में विदाउट लेबल, कोई कलरफुल वाटर होता है, उसका कोई लिटरेचर आपको नहीं मिलेगा। आपने नेट में सर्च करेंगे तो उसका कोई लिटरेचर नहीं रहेगा, ये थोड़ा सीक्रेटली चलता है। सो इफ समवन इज वेरी सर्टन, if someone is do not want to publicize and keep it secret, and you don't have any information on that, these are the red flags of a scam.
सो डॉक्टर, जैसे अभी हमने काफ़ी बात की कि बहुत चैलेंजिंग डिजीज़ है ये, एंड नॉट जस्ट फिजिकली, मेंटली और इमोशनली भी आप पे बहुत डिस्ट्रेस पड़ता है। तो पेशेंट्स क्या ऐसा कर सकते हैं जिससे वो अपना होप और एविडेंस को बैलेंस रख सके?
होप मतलब मैं क्योर हो जाऊंगा करके आशा जो है, दैट्स इम्पोर्टेंट, दैट्स वेरी इम्पोर्टेंट। सो आई हैड अ 4th stage stomach cancer lady, so she was positive, she was very hopeful। तो हम जो भी है सबसे अच्छा इलाज करेंगे, हम टाइम टू टाइम आएंगे, फॉलोअप करेंगे, चेकअप करेंगे। शी वॉज पॉजिटिव, शी हैड द विलिंगनेस टू टेक ऑल ट्रीटमेंट, शी stuck to all the rules and regulations, she did everything, she did exercise, she did everything, but she stuck to the science. So she's better, she's now 4.5 years now, she's fine, even after a 4th-stage cancer. So have a hope of cure, but stick to the science and follow the proven treatment. I think this is the best combination. If you have no hope, probably that's the difficulty. You have hope and you avoid treatment, that's also difficulty. You need to have a balance of both hope and science.
Correct. That's so beautifully put together. So actually, अगर आप पॉजिटिव रहेंगे, अगर आप होपफुल रहेंगे, तो आपकी बॉडी उसको फाइट भी कर पाएगी, ट्रीटमेंट भी ले पाएगी। तो दोनों चीज़ों का मिलन होना बहुत ज़रूरी है। Any parting advice or thoughts that you would like to share with our audience?
Cancer is a difficult disease, definitely, no doubt. Cancer is curable in majority of them. इतना research, इतना advances जो अभी हम देख रहे हैं कभी नहीं हुआ था। People are getting cured, 4th-stage cancer is getting controlled. So if someone has cancer, they get all tests done, go for the proven treatment from a qualified doctor. Don't fall prey to the alternative medicines. You can follow other complementary medicines without compromising the main treatment. So make sure that those complementary medicines are not harming you, but stick to the standard treatment. I think by doing this, the cure is there ahead of you. So cancer is curable, provided you detect it early and go to the doctor early.
Thank you so much, Dr. MV. That was so insightful, and I'm sure our audience loved it also. Thank you so much.
Thank you so much for having me. Yeah.